CMWL's obesity treatment system is designed to simplify the screening and treatment of the complex chronic disease of obesity. Here are some highlights of what the system can do. Even before a prospective patient walks through your door for an initial consultation, you can generate a personalized obesity behavioral intervention plan for them. It all begins with online data capture through the system's weight-focused HRA. It asks basic questions about medical history and lifestyle activities involving food, exercise, sleep, and stress. The answers to these questions run through the system's proprietary algorithm to recommend relevant obesity counseling topics once the patient enters treatment. The HRA also asks specifically about what a typical week of food consumption looks like. Where do you eat your meals and how often? Based on the answers, the system estimates a weekly food cost. This information becomes extremely important when talking to the prospective patient about the good sense it makes to invest in better health. Here in the CMWL Provider Portal, you can see the prospective patient's specific answers to the HRA, as well as the estimated weekly cost of current eating habits. When reviewing your weight loss program's components, compare this weekly cost to the estimated weekly program cost to illuminate the fact that if the person is really motivated to lose weight, then cost really isn't an issue. The United States Preventive Services Task Force recommends that all adults get screened for obesity once a year, and for those with a BMI of 30 or higher, should follow intensive obesity behavioral intervention. The ObesityTX system offers more than 40 individual behavioral module topics across 9 categories, specifically to support the USPSTF's recommendation and to enable providers to receive reimbursement for the service. Implementing your weight loss patients' behavioral counseling plans is easy with ObesityTX. Again, based on the answers in their weight-focused HRA, as well as other data collected during the weight loss process, the system provides recommendations for the most relevant behavioral counseling modules. For each visit, all you have to do is prescribe the next recommended module for the patient online. He or she receives notification of the newly prescribed behavioral module in the patient portal, and that it must be completed before the next follow-up visit because that is the topic you will be discussing. The behavioral modules mainly come in simple multiple choice or true or false formats, and each is accompanied by a provider counseling guide that will help you deliver the most effective counseling session. After each visit, you'll need to generate documentation of the patient's progress and behavioral counseling session to submit for insurance reimbursement. This is no problem with the ObesityTX system. All you need to do is download the visit record PDF and the patient's completed behavioral module if you need it, and include that in your claims form. You can also upload the PDFs to your office's EMR. Finally, your patients will be kept motivated by keeping track of their own progress online, and you'll be kept motivated by being able to achieve the same kind of weight loss outcomes as published in the American Journal of Medicine regarding the CMWL program. As with any new covered service, there is a learning curve for proper billing and coding procedures. But maximizing insurance reimbursement for obesity services is easy when you combine the power of CMWL provider training and the ObesityTX platform. Policymakers are incentivizing medical providers to treat their obese patients. In 2012, the Centers for Medicare and Medicaid Services sent a major signal to medical providers when it introduced coverage for obesity-intensive intervention by allowing up to 22 visits a year. This coverage has been taken a big step forward by the Affordable Care Act, which mandates private insurers to cover 20 wellness visits without copayment or deductible. In 2013, the American Medical Association backed up these new coverage incentives by officially declaring obesity a chronic disease, and the United States Preventive Services Task Force chimed in by issuing its recommendation for providers to screen all adult patients for obesity annually and deliver one-on-one intensive behavioral counseling to those who are obese, allowing between 12 and 26 visits under preventive services. The message is clear. Obesity is a disease and medical providers must treat it. And if they're going to treat it, they need to be compensated, and at generous levels. CMWL's provider training covers the basics of obesity insurance coverage, such as the specialties eligible for reimbursement, Medicare and private insurer coverage guidelines, and a list of ICD-10 and CPT codes associated with obesity treatment. It also covers the nuances for various patient visit scenarios and options for coding and billing, including the use of modifiers to maximize reimbursement. After you've completed training, CMWL's ObesityTX platform then puts the pieces together for you by automatically generating documentation for each weight loss patient visit. All you need to do is download a PDF for your EMR. This documentation includes the patient's name, BMI, body composition metrics, weight loss medications and dosages, vitals, as well as the behavioral counseling module topic discussed during the visit. CMWL's provider training provides the ICD-10 code for preventive counseling associated with each of the different 43 behavioral module topics, making billing and coding for the counseling easy. Once you get verification of your local insurer's obesity treatment service coverage levels, the process for submission becomes an easy, repeatable process. When you combine the revenue generated from insurance reimbursement with program components not covered by insurance, you have a highly profitable business model while helping your patients achieve better health. Find out for yourself what more CMWL's unique medical weight loss program has to offer.